Initially I did an HR apprenticeship with British Aerospace. That led me on to working with a recruitment agency where I covered kind of permanent desks, the temporary desk, and kind of got a good overall experience in recruitment. Initially it was placing nurses in the Middle East, but I always had a passion for the US. So I asked if I could look into kind of getting nurses to the US. Set up and never looked back.
Once we met Lisa, it was her passion for helping hospitals, but even more importantly, just helping people achieve a dream of coming to the United States and working in U.S. hospitals.
And as we progressed and really started talking to our clients about her services, kind of testing the market, so to speak, and we began referring her to some of our clients after we heard some of the success stories that she was having. And then over time, we ultimately chose to start a pathway towards a partnership.
I can see that the company had the same values and ethics that we did, so I was very keen to introduce them to my clients on the international side because we didn't deal with travel or have an MSP, and on their side they didn't have an international division, so we just loosely started introducing ourselves to each other's clients.
We basically started with an idea that we would ultimately offer kind of a comprehensive workforce solution. And I believe international is that final piece to that puzzle, and it ultimately offers hospitals some very viable long-term solutions that previously were not available.
Lisa really builds trust very easily with our clients. It's really amazing to watch her work and to be able to answer the questions and the concerns that these hospitals have.
When the hospitals come to us and they perhaps haven't explored international before, and I think they are intimidated by it because they don't know where to start or what's involved, and they think it's going to be labour intensive on their part. We take all of that off of their plate. We deal with all the credentials, the immigration, that we help them through the interview process. So it's minimally labour intensive on their part, and so we can make it easier. I would say probably more rewarding working with TRS and actually helping the critical access hospitals, who are the ones that have really been struggling, and being able to put our nurses into those hospitals where they've become part of the community and they're really welcomed. They're not just a number, they totally making a difference to that hospital and that community. I think TRS is very different in what we offer the clients. It's a very cost-effective method for them. We charge a one-time fee, and that includes recruitment fee, immigration fees, our relocation fee. It's all included. It's one-stop shop.
She's been able to place thousands of nurses over the years, and in this model, once they become employees of the hospital, they're employees of the hospital. They're not tied to us really anymore, but they are, and they are because of Lisa. Every single day we get anywhere from 2 to 5 referrals from people she's placed 10 years, 20 years. It's just amazing what she's done and what she's created with these healthcare professionals. I'm blown away how she has done that.
We have an amazing team, and they're all specialists in their own area. They're all very passionate about what they do. They care about the nurses and the healthcare professionals. It's not just a job, and every one of the team feels that way. They want to see the journey the whole way through. They might finish with that person, but they're excited to know what that journey looks like the whole way through for them. It's a win-win for everybody. It's a win for the nurses because they get their aim is the American dream. They want to come to the US and change their lives, and that's been really rewarding watching that. From a client perspective, they're getting to fill their needs. They may have had these positions open a long time. They're getting permanent members of staff, which in turn helps the patients, and so it's a win-win from that perspective. And then it's a win-win for us because we get to help both parties and see what a difference we make for both worlds, really. It's not just about one particular person we're helping. We're helping multiple people and in turn their families.